Dean for Educational Research and Innovation at Rutgers School of Nursing. We thank you for joining us today for our webinar series, Healing Ourselves While Healing Others, Nursing During the Coronavirus Pandemic. A few housekeeping items. I just want to let you know that all participants are currently muted and unable to display video. You can send any technical questions about issues you may be having with the technology via the chat function. Please save the Q&A function, below, which is located below the chat, for any questions you would like to ask the panelists. So now it is my pleasure to introduce our team. First, I would like to thank Dr. Jeanette Manchester and Marielle Rosario from our Center for Professional Development for their wonderful assistance in coordinating these webinars and these events. It is my pleasure to introduce you to my friend and colleague, Dr. Donna Gaffney. Dr. Gaffney is an alumna of our Rutgers School of Nursing and has long addressed trauma, loss, and grief in the lives of children, adults, and communities. We are also joined by Millie Elias, who is an advanced practice nurse who will be working with Dr. Gaffney in terms of some stress management techniques today. And so it is my pleasure to introduce Dr. Gaffney, who will now speak to us about welcoming self-compassion, finding support, and self-care.
Thank you so much, Dr. Morrow, and it's so great for Millie and I to be here. Can you hear me? Yeah.
Yes.
I'm going to, thank you. I'm going to turn this over to Millie in 2 seconds, but this is our team that's been working to put this session, this series with you, together for you. And so we're going to hear from Millie today, and we'll hear from Dr. Pipchick later, and also Ann Hoffmeyer, but she may not be joining us via speaking, but her work will be here. So I'm going to now turn it over to Millie. Welcome, Millie.
Thank you, Dr. Gaffney. Thank you, everyone, for participating in today's session. Welcoming self-compassion, finding support, and self-care. Again, my name is Millie Elia, and I'm so thrilled to be presenting this portion of our 7th webinar series. And I'll go through very quickly our goals for this session. Today, I'm hoping that we'll be able to identify your ability to provide self-compassion, locate support in your work and personal lives, recognize toxicity in relationships and environments, and identify some practices, mind-body practices for self-care. This was a quote that I loved, and I just felt the need that I really wanted to include it. If your compassion does not include yourself, it is incomplete. I have this as a picture that I will work through with you by Dr. Christine Neff, who had a lot of research into what is self-compassion. And the first part, self-compassion, starts with self-kindness. So you can see the person looking at themselves in the mirror with a heart. And what does self-compassion mean? Well, it means being gentle, kind, and understanding with yourself, accepting that you are not perfect, and understanding that there is potential for learning and growth in every mistake you may make. There are 3 components, 3 elements. The first one being self-kindness, and that means becoming aware of how we speak to ourselves. Ask yourself this question: do you speak to yourself like you would speak to a friend? Sometimes not so much. Speaking for myself, if you may need to, if you're not speaking to yourself in the same way that you would speak to a friend, you may want to try to practice the first element of self-compassion, which is self-kindness. Self-kindness is the ability to be gentle and understanding with ourselves when we are experiencing some sort of turmoil. So we're living in very challenging, unprecedented times. And whether you're a student or a clinician or faculty, I think we're all sort of having this shared experience of some sort of turmoil in our lives at this point in time. The second component of self-compassion is common humanity. And by that, that means recognizing that our failings and sufferings as part of the greater human experience. At times, we take our own suffering as a sign that something is wrong with us or that we are different from other people. The principle of common humanity acknowledges that we suffer because we are human. We also understand that there is no suffering we have undergone that others have not also experienced. When we practice the principle of common humanity, we see our pain, inadequacies, and failures as part of that human experience, not as a sign that something is wrong with us or that we are alone in our experiences. We know that there is no emotion we experience that has not been experienced by others. We also begin to see the suffering of others around us as part of their human experience and not disconnect it from them, labeling them or judging them. The third component or element is mindfulness. So self-compassion is mindfulness, or the ability to have an awareness of feelings that you are experiencing without avoiding them or over-identifying with them. When we are mindful, we observe our thoughts and experience our feelings without judgment or applying a greater meaning. We hold our painful feelings as part of our experience. We don't cling to them or run away from them. We see things for what they are, and in some ways, we give ourselves a reality check. Many of us engage in behaviors that may temporarily numb the feelings we're having. For example, it's not uncommon when we start to feel anxious. Some of us may grab a phone to zone out for an hour, playing apps, or if we feel sad, we may run to food or even alcohol to make ourselves feel better. If instead of such actions of immediately taking that which comforts us in the immediate sense, if we practiced mindfulness and we hold that anxiety or sadness and just acknowledge it, if we will feel it and not attach meaning or judgment to it, if we try not to hide from it or overly identify with it, simply observe it. This mindfulness, this state of mindfulness is a non-judgmental state where we simply observe what's going on inside of us. It's a moment of pause to just see what our feelings are at that moment. Now, one of the reasons that I have this slide as self-compassion as a self-care strategy is because self-compassion and self-compassion can lead to self-care. It can be a tool in your toolbox. When nursing students are taught to have self-compassion while they're in training, it is an excellent way to increase the practice of self-care as a clinical nurse and beyond. I can remember from my own schooling that self-compassion, self-care strategies was not in the curriculum in either my undergraduate or graduate schools. This is something that is very important as we enter into this new age. instilling in what we hope to help others with, we must instill in ourselves first. That old adage of put your oxygen mask on first in order to help others holds true. Research on self-compassion has correlated its practice with numerous beneficial outcomes. Self-compassion is positively correlated with initiatives that kind of get up and go. I want to do things, to wisdom, satisfaction, emotional intelligence, social connection, a general feeling of happiness, and positive affect. It really shows on our countenance when we have that feeling of self-compassion. It's negatively associated with self-criticism, thought suppression, perfectionism, anxiety, rumination. Self-compassionate individuals have lower anxiety and depression levels and employ adaptive coping strategies, more adaptive coping strategies than their less compassionate peers. The research that has been done on this suggests that self-compassionate individuals have an overall increased well-being, both physiologically and psychologically. Because self-compassionate individuals have lower anxiety and depression levels and employ more adaptive coping strategies than their less compassionate peers, the research suggests that self-compassionate individuals have a greater sense of well-being and are able to move forward more easily in times of turmoil. So why is this so important to nursing? Why was this introduced at this point in time as a topic for nursing? Well, nurses make up the bulk, as you know, of the healthcare workforce and are natural problem solvers and innovators. We therefore stand out as indispensable at any time, but especially during public health emergencies such as the one we're undergoing now with COVID-19. So prioritizing self-care becomes more crucial than ever at times like this. We'll explore how using self-compassion as a means for self-care a little bit further, but just know that having students begin to learn this as part of their curriculum becomes vital, and there's the need to integrate, and not just learn it, integrate their own self-care practices. Self-compassion is a simple practice used in the immediate moment or even as an activity at home. So really, it's a moment you can take, whether you're in class, on the floor, in your home life. It's a moment that you can reflect on yourself and can be done anywhere at any time if you've learned to use it. Self-compassion as self-care is an effective avenue to increase compassion and relationship building, not just with ourselves, but with patients, and helps to strengthen relationships also with our coworkers. It's also part of our professional responsibility. Provision 5 of the Code of Ethics for Nurses says, the nurse owes the same duties to self as to others, including the responsibility to promote health and safety. We understand health holistically to refer to mind and body. Self-compassion as self-care is an effective avenue to continue forward and build new relationships, not only with our peers, but beyond, affecting our environment, whether that be in our community or in our institutions. Locating support in your work, school, or personal lives is extremely important. As a nurse, you will be working as part of a greater healthcare team. Nurses need to build supportive and compassionate networks and relationships with their team to sustain their own mental health and well-being. How well the teammates function together as a whole impacts how the team performs. I'm going to use the example of a project actually outside of the realm of nursing done by Google many years ago called Project Aristotle. It was called Project Aristotle, just a little background information, because he was quoted as saying, the whole is greater than the sum of its parts. Google wanted to research if employees who worked together did better and were more productive depending on how they worked together. So that was what they were exploring. What makes a team effective at Google was their question. Using this example of Project Aristotle, done somewhere in between 2012 and 2016, hundreds of Google teams were studied to identify why some teams thrived and others didn't. The norms that mattered most in the thriving teams were that members listened to one another and showed sensitivity to the feelings or needs of others. So when you think of your own network, whether that be with other students, with other nurses, your peers, I invite you to start to think about mapping out your network, your connections in these areas. Who do you talk to for information or go to for support? Begin to identify intangible and tangible value that you obtain from these networks. So what do I mean when I say intangible and tangible? Well, looking at intangible, who can you go to that will show you kindness, empathy, compassion? Who will help generate ideas with you? Who helps you to reframe problems in your own mind? Who helps you to brainstorm? And maybe who even helps mentor you? Now, in terms of tangible value, there are those that we can go to help improve our coping and resiliency, that help us to improve our clinical skills, help us learn how to talk with patients who are going through severe crisis, who may be dying or have a dying family member. Understand the difference between the values of intangible and tangible, and no matter where you are in your career, begin to map out those resources that you can refer back to when you need them. Once you've identified them, how do you sustain these networks, these connections? How does the value also enhance your ability as a nurse? Start to think about, how can I nurture these relationships? How do these enhance my ability as a nurse, my mental health, my wellness? Begin to consider ways that you as an individual can support your own resiliency. There will be times, or there may have already been times during your clinical practice when you have had to have moments of practicing what's known as the pause. Now, the pause can be simply pausing from one patient's room to the next, sort of grounding yourself and centering yourself before going into the next patient. It can also be a medical pause in which, if there is a patient who is undergoing cardiac arrest and the team is working to save their life, and the person dies, the team may have a moment of pause to acknowledge their work and the person. And Donna's going to go more into that in an upcoming session. But these are ways you can begin to consider how you can build your own resiliency. I invite you to also look at your professional nursing associations for community forums, journals that reflect what you are going through. There are nursing associations like the American Holistic Nursing Association, really support holistic nurses and offer programs that speak to resiliency. One thing to consider in various institutions where you may work are what sort of employee assistance programs that they have. Whether you work in an institution now or will in the future, that's something to seek out. Employee assistance programs offer professional help when you need them. They offer many resources for well-being, psychological health well-being, and often extend these resources to the employees' families. These resources are confidential and free. So that's something to consider. I would also invite you to consider innovative practices around nurse wellness. Consider brainstorming, whether you're in a clinical environment now or will be in the future. Envision the kind of workplace that you would want. I invite you to think about ideas such as renewal rooms, which have been studied in some hospitals. This is a new concept, fairly new. A renewal room is a place on a unit that is a quiet zone for nurses. It can consist of many things, such as aromatherapy, music therapy. It can even have a massage chair, a place to journal, possibly even a little waterfall type of structure in the room, a peaceful, quiet environment. This can be suggested by anyone or by the team. Initial surveys of places, institutions that have implemented this show that 96% of the nurses on the staff use this type of room. And they feel that it positively impacts their well-being while they're on the floor. The rooms are so successful that the administrators of these units have supported the building of other rooms throughout the institutions. And in some places, they're now called the Serenity Rooms. Certain hospitals have implemented a particular staff member to be the unit shift leader. When other nurses are taking their breaks, if they need a timeout or pause, the unit shift leader can step in. This person doesn't take an assignment. Instead, his or her role is to relieve other nurses. So each member of the staff can get adequate renewal time. And this includes taking control of your breaks. The ability of nurses to get adequate rest and rejuvenation should be important to all employers, but individual nurses do not have to wait for management to make improvements. You can speak with your teammates about making a system that allows for this. Our next slide I want to talk about recognizing toxicities in relationships and environments. Our society is more health conscious than ever before. We are paying increased attention to nutrition labels, fitness opportunities, organic alternatives, toxin-free environments, and more. And yet, even many health-conscious people don't realize that the quality of their relationships can be just as toxic to their health as fast food or any intoxic environment. In fact, unhealthy relationships may contribute to a toxic internal environment that then can lead to stress, depression, anxiety, and even medical problems. Toxic relationships can take many forms: toxic partners, toxic friendships, toxic family relations, and toxic coworkers, just to name a few. These relationships or environments can be similar in how they make you feel. Toxic relationships are characterized by a sense of insecurity, a feeling of abuse of power and control, feeling criticized, a sense of negativity, distrust, and being the recipient of demeaning comments. If you find yourself in a toxic environment or relationship, some strategies that you can use to address the behavior is address them when they occur, using I statements as much as possible to reduce the likelihood of a defensive reaction. So, for example, I feel like you find fault in almost everything I do, and it makes me feel whatever, fill in the blank, whatever your feeling may be at that moment. Another suggestion would be to get comfortable with setting boundaries by saying no. And no is a complete sentence. If you feel that you are overextending yourself, one way to reduce your stress is by being very honest and saying, I don't choose to do that now. I don't have time to do that now. No helps you to maintain your boundaries and lessens tension within you. Taking control of your environment can have huge impact. Things like turning off the TV with the news bombarding us these days, it can be very distressing. If there are particular people that distress you in the work environment or in your relationship, try to consider distancing yourself as much as possible while you can. And if it's in a work environment, don't be hesitant if it goes on for a while to consider the option of needing to transfer or looking for other employment. Positive relationships are an important part of the formula for a healthy, well-balanced life. So make sure that your health-conscious lifestyle doesn't leave out this crucial ingredient. And now I'd like to talk to you about finding your self-care strategies. Different things work for different people. So I'll give some examples just to begin to nurture your imagination and start to think what resonates with you. You can try some, or think of some others for yourself, but this is some things I wanted to offer. We know, especially as nurses, that taking care of our physical, mental health is important. We also need to incorporate healthy eating, rest, exercise or active living, relaxation, and meditation. Meditation is something that I'm often told, I can't meditate, it doesn't work for me. There are many forms of meditation, and we can get into that in another session. But just know that these are equally important in your own self-care. Talking with someone about your feelings or using a buddy system to support yourself when you're at work, finding a nurse that you can confide in, who can confide in you to support each other emotionally. I'd invite you to maintain as much normalcy and routine in your home life as possible, knowing that what is normal that it is normal to be affected emotionally by large-scale disasters and outbreaks. If the news or social media or other information outlets are overwhelming, consider stepping away and disconnecting. Your institutions can support you by discussing the signs and symptoms of secondary trauma or stress. Early recognition and intervention are important. Normalizing these conversations is important. Your institutions can conduct regular debriefings and reflections as a unit or department. They can reinforce with the staff about having mental and physical reactions during or after a disaster situation and know that this is normal. But it's worth saying that if you have tried strategies and these feelings of distress don't go away, or you're experiencing a number of intense symptoms simultaneously, additional intervention may be needed. By that, I would ask you to seek a psychological health counselor, a therapist, someone that you can speak to professionally if your stress becomes overwhelming. And now I'd like to do a wonderful exercise that Dr. Gaffney has brought into the program. And we'll start with the first, which is, as you can see, a picture of a small child. And this is really asking you to reflect back on your childhood, to what made you feel better when you were sick or sad or lonely, when you were stressed. And if you can list 3 to 5 things that gave you comfort, we'll go back to those things in a little bit. But just start to think about that, and I'll give you a few minutes before going on. It may be in your childhood that there was a special place, a particular person. Maybe you enjoyed a particular food like ice cream. Maybe it was a special activity. I'm going to go ahead and move to the in another moment. I'll give you a few more seconds to think. Okay, we'll go ahead. And move. It might have been even an area, park, swings, riding your bicycle, getting lost in books. It's not often that we are asked to reminisce and write down these sort of answers. Okay, so we'll move on to the next slide. So this one is thinking about the last time you were upset as an adult, as you are now, even thinking about today, this past few days, this weekend, when you were stressed out or just plain out of sorts. Think back now to what gives you comfort as an adult. Again, would it be maybe a movie you saw, a particular song? Just 3 to 5 things that help you now. What have these last few days been like for you? What has today been like for you? Again, we'll take a few minutes and give everybody a chance. Perhaps you have a pet, a cat or a dog. Maybe you enjoy volunteering your time at an organization or agency. Maybe you have a house of worship, a community that you enjoy being with. Maybe it's a physical activity. Perhaps you love to dance. Okay. I think we have completed our poll, our second poll. And so I'll see if I'm able to see if I can get any of the answers or responses rather. There's always, I find, similarities. Remember, we talked about the common humanity. Oftentimes, the things that we enjoyed as children or even enjoy as adults become surprisingly similar. I think one thing that is important to have a look at for yourself is in looking at your childhood likes and comforts and comparing them to your likes and comforts as an adult. Taking a look at those two answer sheets and beginning to notice for yourself within your own life the similarities. Are you able to choose or pick out anything that comforted you as a child that translates in some way or form to a comfort measure that you have now as an adult? That can be surprising for some people to see that. They didn't even realize. And so if that's true for you, that's something to keep in mind and to consciously tap into during times of stress, remembering that the core of who you are and the things that comforted you hasn't really changed. It may look different, but that sense of comfort still remains. So now we've reached the portion of this session where I'm going to offer an invitation to you to join me in a relaxation exercise. And I love this quote also because it really speaks to the breath work that I'm going to invite you to join me with. Sometimes the most important thing in a whole day is the rest we take between two breaths. So it's time to breathe and stretch. And I want you to know that anything I do or invite you to do, if you're not comfortable for any reason, if for whatever reason you don't want to participate or it's not comfortable to participate, that's perfectly fine. Each week I'll be coming up with new activities. And so at any point in time, if any of those resonate with you, you can always join me. To start, I'm going to invite you to practice a breathing technique with me today, which calls for us to begin to notice the pause between our breaths. So the awareness of the pauses that come after inhalation and exhalation is a very simple but effective method for quieting the mind and opening ourselves to our inner stillness. That inner stillness is our true nature. Pauses are always existing in any kind of breathing cycle. At the end of an exhalation, before the next inhalation starts, there are always these precious moments of silence and stillness that we can tap into. The important element of noticing the pause and is not the pause itself, which may only initially last a second or so, but the awareness of it and the feeling of being centered that is associated with that moment. Once we've done a cycle or two of natural breathing and we've begun to notice that pause, I'm going to gently move us onto some postures, some seated postures to go along with those breathing exercises. The movements that I'm going to take you to can be done anywhere and modified again to your comfort level. But by pairing them with your breathing, you'll start to find yourself feeling more centered and more relaxed in any environment with practice. We'll simply start by watching our breath, becoming aware of our natural breathing. I wouldn't ask you to change your breathing in any way at this moment. Just noticing your inhalation through your nose and exhalation through your nose. We'll start by breathing slowly. And as you exhale through your nose, I'd ask you to extend that exhalation a little bit longer. And with your next breath, as you inhale and exhale, at the end of that slightly extended exhalation, notice that pause. Notice if you can add another second or two to that pause before breathing in again. The more often that you're able to begin to become aware of that pause, extending that exhalation, extending that pause, the more likely it is that your parasympathetic system will shift into gear, moving you from sympathetic to parasympathetic. You're beginning to slow your breathing down. We're going to now move into the postures, and I'm just going to adjust this so that I can move back and you'll be able to see me. We'll start by, this is going to work. I'm going to have to disconnect. I'll start by asking you to move to the very front of your seat, staying as close to the front as you can without feeling like you're going to fall off. I want you to stay nice and secure, but come to the edge of your seat. And from here, bring your spine to a nice length, rolling back your shoulders, bringing your hands down to your side. If anything, again, feels uncomfortable or causes you pain in your range of motion, you know your body best. You can always just follow your breath. We'll start by inhaling, bringing our arms up over our head. And you can join your hands together, but if that's uncomfortable, you can also keep your arms apart, lower down, however you're most comfortable. I'll ask you to take a moment, inhale, and exhale, leaning all the way to one side. I'm leaning towards my left, and that's to you, I believe that'll look like the right. Lean towards one side, and you're really feeling that stretch on the opposite side before taking a moment and coming back to center. Inhale and exhale now, leaning towards the opposite side, feeling that stretch again on your side before coming back to center. Bringing your arms down. Now I'll move my chair sideways, and here I'll have to back up so that you can see
Okay.
Okay. Moving the camera down a little bit. You can come to the very edge of your seat, keeping your spine nice and long, and keeping your feet flat on the ground. I'll ask you to bring your hands to the back of your seat. And begin to bring your chest forward and your shoulders towards each other as you begin to look up slightly. This is called cobra. So you have a slight curve to your back. You're opening up your chest, allowing your lungs greater space to inhale, taking a moment. Inhale, and as you exhale, begin to slowly center your spine and bring one hand, each arm, one by one, back to center. Next, I'm going to bring my right knee up to my chest. Now, for you, that may look different. We all have different levels of flexibility. But for me, I'm going to be able to interlace my fingers. That's what's comfortable for me. Bringing my right knee up as far as I can, as far as I'm comfortable. And then I'm going to begin to make some simple circles to the right and to the left. I'm still watching my breath. I'm watching the beginning and end of an inhalation and exhalation. And now I'm beginning to point and flex my feet. I'm going to start to curl my toes in my shoes. And when I'm ready, I'll take a moment and gently bring my leg back down. Now, everything I do on one side, I want to do on the other. So I'm always interested in keeping that balance. So I'm going to go ahead and do that on my left, bringing my left knee up. And that may look like this. This may look like that. It could even look like this, wherever you're most comfortable. Again, I'm going to make some simple circles. And I'm noticing what my ankles feel like. Does this feel good to my feet? Curling my toes. Oh, you may hear some cracking. That's okay, so long as nothing hurts. Take a moment, inhale, and exhale, bringing your leg gently to the ground. The next is called spiral twist. So, keeping your legs firmly on the ground, bring your right arm behind you. We came to the front of our chair, so we have plenty of space, right? I'm going to bring my right arm to hold to the back of the chair, and I'm going to cross my left hand over to my right knee. I'm going to take a moment, inhale, and exhaling, slowly turning my spine, my neck, rotate my neck to look over my right shoulder. Now, you only go as far as you're comfortable, and that may look more like this. To whatever degree you can, you'll turn as far as you can. Take a moment, inhale, and as you exhale, slowly come back to center, one arm at a time. Even just these few movements, I ask you to now reflect on how your body feels at this point, comparing it to when you first started the session, when we first started the session. We don't get a lot of opportunities to move our bodies and our joints in the way we're actually made to. And so these muscles of ours, they get very tight. They hold a lot of that tension. A few simple movements, watching your breath, can really be a powerful tool that can impact your day. You can see my lights are flickering. Excuse me if you lose me a little bit. But that is our presentation for today. And we are opening the floor for any questions you may have.
Thank you, Millie. At this point, we don't have any questions, but if anyone does have any questions, please feel free to sign into the Q&A box and add anything that you would like. We have about 3 or 4 minutes remaining.
As you can see, I'm not a very techie person, so I have to plug myself back in. Can you hear me?
Yes, we can.
Yes, can. Well, I have a question for you, Millie. So I don't do regular yoga because I have vertigo. So when I put my head down, I don't do it. So I'm very interested in this chair sort of version of yoga. I'm very interested in the when you were sitting and twisting your body, and I could feel it actually in my shoulders. So how many minutes would you suggest we do that? I'm thinking of if somebody's at work or sitting at a computer all day. How many minutes would you recommend?
Well, we talk, and did I turn myself on? Am I on?
You're on.
I'm on. Okay, good. We talk in the world of yoga in terms of how many breaths. So it's really up to the person. 1, 2, or 3 breaths in any position would be fine. And it's really individualized. So some people cannot really pause their breath for that long. They're not comfortable maintaining a particular posture for that long. So in terms of how many breaths you can, because the whole thing was inhaling, exhaling as you're turning, taking a moment, inhaling, and exhaling as you're coming forward. So it's all in time with your breath, connecting the body with the breath.
And will we be able to post the directions for that particular movement?
Oh, absolutely. I actually have a PDF that I received from my teacher, and it goes through each of the steps. I didn't include one because I sort of ran out of time, but all the other steps are perfectly described. There's pictures and content.
Great. So we'll be able to post those. Great, thank you.
Absolutely.
So it seems that we're at near the end of our time. Millie and Donna, did you have one last comment that you wanted to make, Dr. Gaffney?
No, no, I don't. I think that these first 2 sessions were really about a lot of self-care. We're going to be getting into a lot more content in the next session coming up. But I think that Millie and I wanted you all to have the tools that you need to deal with a lot of what's going on in our work and personal lives today.
So on that vein, we do have one final question about how can nurses on duty adapt the serenity room or renewal room in these challenging times in the midst of a COVID-19 pandemic?
Yeah, that is a really, really good question. Millie, do you want a few thoughts?
I do have some thoughts. That's a great question. Thank you. So the idea of a renewal room or serenity room in totality may not be possible in the next week or 2 weeks. So working with what you have and looking at your environment, and you know your environment best, what your unit looks like. Is there a corner of a break room that you can set up that becomes very serene in colors and sounds, and depending on people's preferences, aromatherapy. You don't necessarily need the whole room. A room would be ideal, and it's something that I offer to brainstorm for the future. But when you're in the midst of the storm, just work with what you have. you can make your environment work for you with a little bit of creativity.
And if we have, I know we're at the end of our time, there's just very quick questions. How often to do, if we can answer very succinctly, how might often do you recommend to do the motions when you're doing the yoga? And also, do you think nurses are more at risk in being in toxic types of relationships, if you can answer that briefly? And we're seeing lots of very thankful participants for the techniques that you've shared today.
Millie, I'm going to let you take the first part, and I'll take the second part.
Yes, fantastic. Ideally, once a day of 10 minutes of any kind of therapeutic movement is ideal. But ideal is ideal. Start from where you're at, take your first step, and however many minutes you start with, you can build up. Once a day, 10 minutes is the ideal, and you make that, how you need it to be.
Dr. Morrow, good question about toxicity. Whether nurses actually experience more toxicity in the workplace, in relationships, probably isn't well defined, because a lot of people don't admit that they are in those relationships. But I always give the idea that if after you talk to someone you feel worse than before you talk to them, that's probably a toxic relationship. And I think it's really important to understand and to pull away and recognize that it's not good for you. And it's very difficult now, because nurses are, we're heroes, we're angels, we're actually doing our jobs more than anything else. So we've got all this very public adulation, and yet there are still difficult moments. I mean, I've talked to a couple of my clients who are in the profession, and in the midst of all the storm in the emergency room with everything going on around, there's still people that aren't pulling their weight. And then when you confront them on it, which is what Millie suggested, we really have to use our voices, then they, pull back and they get defensive or get offensive with you. But I think that we're going to be talking more about making sure that we use our voices. So I think we have to be very aware of when we feel like we're in a toxic interaction. And just the first step is to just identify it. I don't feel any better after I'm talking to this person. So that's a good starting point. We're going to talk more about that.
Thank you, Dr. Gaffney and Millie, and those are great pieces of advice. And there was a last question, and I think you just addressed it, Dr. Gaffney, because it talked about what do you do with coworkers who are rude when you call to ask questions or are overall annoyed, and you talked about using your voice. Millie talked about using I statements. So I think you will address it further in the next, in the next session. So
hold on to those questions. We'll be talking about them again.
Thank you so very much, Millie and Dr. Gaffney, and everyone who's joined us on the webinar. As you check out, you will see that you have an opportunity to answer the evaluation for continuing education credit, and we will also have these resources posted for you, the recording and the handouts on the website. So thank you all. Stay safe, be well, take good care.
Good night. Thank you. Thank you, everyone.